Imagine a leak in a hospital's finances. A leak so big it could fund entire new wings. Now, this isn't about some complicated billing code or a high-cost procedure. Nope. It's happening right now in the very flow of patients through the building. And get this, it's costing healthcare systems up to 30% of their potential revenue. Today, we're going to talk about how to plug that leak. So what is it? What's this silent saboteur of hospital efficiency? Well, it's the reason a patient waits for hours in the ER for a bed that's technically empty. It's why a multi-million-dollar surgical suite just sits there, completely unused on a Tuesday afternoon. It's a massive logistical breakdown, and the scale of it is, well, it's just staggering. The number we're actually talking about here is between 20 and 30%. Just let that sink in for a second. Up to a third of a hospital's potential revenue is just gone. Not because of a lack of patience, not because of a lack of clinical skill, but because the very logistics of patient care are broken. Okay, so let's start by pulling back the curtain on this unseen revenue leak. In this first part, we're going to define exactly what's causing this financial hemorrhage and why it has such a powerful and, honestly, often devastating impact on a hospital's bottom line. The culprit has a name: patient flow inefficiency. Honestly, the best way to think about it is like a horribly designed highway during rush hour. You've got plenty of cars, those are the patients, and you have plenty of destinations, the beds and the operating rooms, but the traffic flow is so bad that everything just grinds to a halt. It's the system literally getting in its own way, creating total gridlock where there should be smooth movement. And this is where that abstract idea really hits the real world, right? When an ambulance has to be diverted because the ER is full, that's not just some logistical problem. That's thousands of dollars in lost revenue for that one single patient. Or when your grandmother can't be discharged on time, it's not just a pain for her, it's a blocked bed for someone else who's waiting in pain. It's just this cascade of missed opportunities, and every single one has a price tag you can measure. But, and here's the flip side, this is where it gets really interesting. You don't need some billion-dollar construction project to see massive gains. For a typical 300-bed hospital, just a 12% jump in efficiency can unlock millions in new annual revenue. The capacity is already there. It's just trapped inside this inefficient system. So the potential for improvement is just massive. But to unlock it, we first have to understand what's causing the problem in the first place. So let's dive into our next section and really diagnose the 4 main bottlenecks that are choking the whole system. First up, siloed data. Okay, imagine trying to conduct an orchestra where the string section can't hear the percussion. That's pretty much what's happening in so many hospitals. Bed management is operating in its own little world, totally disconnected from the surgical schedule, which, by the way, is completely blind to the discharge plans. Without a single unified view, teams are just constantly putting out fires instead of preventing them from ever starting. Next, we've got the huge bottleneck of manual discharge planning. So many of these decisions are made in this tiny window during morning rounds, with almost no foresight into who's going to be ready to go home later in the day. This creates an average delay of 3 to 4 hours per patient. Now, multiply that across hundreds of beds every single day, and the gridlock just becomes immense. The third bottleneck is something I like to call flying blind. You'd be surprised, but most hospitals are really bad at predicting how many patients are going to walk through their doors in the next 24 to 48 hours. This lack of forecasting leads to this constant state of chaos. Either you're overstaffed and you're just bleeding money, or you're understaffed and you're in a full-blown crisis. There's just no way to plan ahead. And finally, there's the lag. A nurse checks her system and sees a bed is clean and ready, but in reality, that information might be 30 minutes old. By the time they act on it, the next patient has already been waiting way too long, and that one little delay ripples outwards, affecting every single step in their care journey for hours to come. Okay, so we've spent a lot of time diagnosing the problem. Now it's time to talk about the cure. And the solution isn't about asking an already overworked staff to just work harder. It's about a structured, intelligent business transformation. It's about finally giving them the tools they need to work smarter. So here it is, the 5-step roadmap to a much more efficient hospital. First, you have to break down those data silos we talked about. Create a single, unified view of the entire system, so everyone is finally working from the same sheet of music. Second, you use AI to move from being reactive to being predictive, forecasting admissions and discharges with incredible accuracy. Third, you automate the tedious, time-sucking process of assigning beds, which frees up nurses to focus on, actual patient care. Fourth, And this one is absolutely crucial. You create a central command function. Think of it like air traffic control for the hospital, with the authority to make system-wide decisions and eliminate all those departmental turf wars. And finally, you measure what really matters, the financial impact of these changes, not just the clinical stats. So what happens when a health system actually commits to this kind of transformation? Well, the results, as you're about to see, are pretty remarkable. Let's take a look at the data-driven payoff. Wow. Okay. What's really incredible about this is just the sheer scale of the improvement. I mean, look at these numbers. Bed utilization jumps by over 10%. The time it takes to get a patient from the ER to a bed is more than cut in half. The rate of morning discharges, it doubles. This isn't just tweaking the system a little bit. This is a fundamental reinvention of how a hospital operates. And this quote from our source material absolutely nails it. The difference between an average hospital and a high-performing one isn't the number of nurses or doctors. It's the quality of the data they have and their ability to make smart decisions based on it. It's a data gap. Let's just zoom in on one of these metrics to really see the ripple effect. Discharging patients before noon is the single most important factor in preventing that afternoon gridlock. So by more than doubling the industry average, these optimized systems create a steady flow of available beds all day long. It's really the key that unlocks the entire system. So yeah, while we've been talking about millions in recoverable revenue, the ultimate benefit here is human. This is about making space to treat more people. It's about shortening those anxious waits in the emergency room. It's really about fulfilling the core mission of healthcare more effectively, just by using the resources you already have. And that leaves us with a final, really powerful question. The money is there to be claimed. More importantly, the patients are there, waiting for care. The tools to fix this problem exist. So what's the holdup? The only thing missing